The victim was 54 years old, no signs of trauma, no blood, no weapons. His family said he was perfectly healthy just 1 hour earlier. When EMS arrived, he was dying, and the killer was standing right in front of us. Could you solve the case before we did? Dispatch sent us to a 54-year-old male with difficulty breathing and chest discomfort. Nothing about the call sounded unusual. When we arrived, the patient was sitting on the couch. He was pale, sweating heavily, anxious. He kept repeating the same words. I just don't feel right. His blood pressure was 92/60. His heart rate was 112. His respiratory rate was 28. His oxygen saturation was 98%. He looked critically ill, but his oxygen level was completely normal. His wife told us he thought it was heartburn. He had taken antacids. They didn't help. Instead, his condition continued to get worse. We performed a 12-lead ECG. There was no obvious STEMI. Now what? This is where many providers stop looking. But good clinicians don't stop when the first test is normal. They keep investigating. So let's consider the possibilities. Was this a panic attack, a heart attack, a pulmonary embolism, or an aortic dissection? Before I tell you the answer, make your decision. What do you think is killing this patient? Then something changed. The patient said the pain had moved. It started in his chest. Now it was in his upper back. That immediately caught our attention. We checked his pulses. His right radial pulse felt strong. His left radial pulse was noticeably weaker. Then we checked blood pressures in both arms. The right arm measured 94/60. The left arm measured 74/50. Those findings changed everything. The diagnosis was an aortic dissection. A tear had developed in the wall of the aorta, creating a false channel for blood flow. That false lumen reduced blood flow to the left arm, causing unequal pulses and different blood pressures. The pain migrated from the chest into the back as the dissection progressed. The patient was already beginning to go into shock. The ECG wasn't dramatic because this wasn't primarily a blockage of the coronary arteries. Without rapid recognition and immediate transport to a facility capable of surgical intervention, this patient would likely have died. Here are the lessons from this case. Never ignore sudden severe chest pain that patients describe as tearing or ripping. Pay attention when pain changes location. Always compare pulses if something doesn't seem right. Consider checking blood pressure in both arms when an aortic dissection is suspected, and never let a normal ECG convince you that the patient is stable. Sometimes the monitor doesn't reveal the diagnosis. Your assessment does. Every EMS call is a mystery waiting to be solved. Your job isn't just to treat the patient. Your job is to identify the killer before it wins. When did you know the diagnosis? Let me know in the comments. I'll see you in the next EMS Mystery File.